Hello, my friends, my family, and my fans. I am Andrew Ditch. I have been diagnosed with autism and intellectual disability. Today, I want to talk about a really important topic. This is very important for millions of other adults with autism. This topic shows how incompetent the medical and mental health field really is. You go to a doctor when something bothers you, like when physical pain, stomach problems, or even when your behaviors are not seen as the social norm. This is where I start with how incompetent doctors are in identifying autism and intellectual disability and how they often can use masking as a way to misrepresent someone's behaviors as noncompliance or argumentative rather than part of their intellectual disability or developmental disability. Today, I am starting an introduction to the mental health system and how it fails millions of people. This starts with the diagnostic overshadowing and misrepresentation of someone's behaviors and/or assumed capabilities that are used to deny one of proper diagnosis, treatment plan, supports, and are often ignored. This starts with trusting your healthcare provider and expecting them to understand autism, intellectual disability or developmental disability, and acceptance of your conditions and limitations are not defiance, mental illness, choice, or manipulative. Systemic barriers to the autism-specific expertise and narrow service design. Because your healthcare provider has no training of autism, they often blame the autistic person for refusing to comply. Example, I am prescribed many medications, and I am not able to take my medications like I need to. I am capable of using a phone, computer, AAC device, and other technology. This makes the provider to assume I can set an alarm and respond to the alarm. However, I am not able to. The reason: central auditory processing disability. I hear the phone. I am not able to respond to it. This makes healthcare professionals to call me lazy and uncooperative and not complain to taking my medications. Add the many medications I take. I am not safe at reading and being able to fill my medication boxes safely. So, I am not going to hurt myself for something I am not mentally capable of doing. Top this off, because I am not able to fit my diaper on properly, my diaper leaks and falls off me. This makes my living environment unsanitary. I am seen as refusal to use the toilet, as my sensory processing challenges are to why I cannot help this. I have a diaper rash that causes me severe pain. This is going to be blaming me for not wiping or purposefully refusing to take a shower. Except for the fact I take a shower and use soap but need help with wiping and taking a shower. As a result of this, is seen as non-compliance and choosing not to take care of myself. Add the fact I am not able to feel when I am thirsty. I am dehydrated and need help with planning my day, and help me follow my day to help me drink water. It is not something I can do. Nurses say just drink water. You know you're dehydrated, just drink water. If it was that simple to do, I would be doing that. It is not. I weigh almost 300 pounds. I cannot feel when hungry. I cannot know when I need to eat. This makes me not eat normally or at normal times. I also cannot feel when I am full. This makes me eat at least one time a day, and usually until I get sick. This is not my choice. I do not feel cold. So guess what? It will not hurt me when I am homeless on Friday. I am not going to care. I also cannot see or tell how far a car is from me. So I can get hit by a car. Guess what? I am not scared of hurting myself. It is not fair to me to die or get hurt because of others who neglect autistic people. A healthcare professional is going to get out of criminal liability for using their lack of training to evaluate and not care for the health of an autistic adult. Or they will use social media as an alibi to say I thought he was faking it. Or use my own guardian for why he refuses to help me and be truthful about my healthcare needs. As my own dad, who is my guardian, tells everyone I am defiant and choose to have my ass wiped. Systemic barriers to the autism-specific expertise and narrow service design. Below is a deeper, sharper breakdown of the systemic barriers that specifically block access to autism-competent mental health care, with a focus on why autism-specific expertise is so rare and how narrow service design excludes autistic adults by default. This goes beyond general provider shortages and gets into the structural mechanics that keep the system inaccessible. Systemic barriers to autism-specific expertise. These barriers explain why clinicians rarely have the training, confidence, or infrastructure to support autistic adults, especially those with intellectual disabilities, AAC needs, or high support needs. 1. No required autism training in mental health licensure. Across psychology, psychiatry, counseling, and social work, autism training is not required for licensure. Graduate programs may offer 0 to 5 hours of autism content, usually child-focused. Adult autism, sensory processing, AAC, shutdowns, meltdowns, and executive function disability are almost never covered. Systemic effect. Clinicians graduate fully licensed yet unprepared to recognize autistic distress, adapt therapy, or distinguish autism traits from mental health symptoms. 2. Autism knowledge is treated as a specialty, not a core competency. Autism is framed as a niche population rather than a common neurotype. This means only a small subset of clinicians seek extra training. Most clinics assume autistic adults are too complex or not their population. Insurance networks rarely list autism-informed providers. Systemic effect. Autistic adults must hunt for rare specialists instead of receiving competent care anywhere. 3. Adult autism is under-researched and underfunded. Most autism funding goes to early intervention, ABA, childhood-focused services, genetics, and causation research. Very little goes to adult mental health trauma. In autistic adults, AC accessible therapy, autistic burnout, co-occurring intellectual disability. Systemic effect. There are few evidence-based models for adult autistic mental health care, so clinicians lack guidance and training materials. 4. Insurance doesn't reimburse autism accommodations. Clinicians are not paid for longer sessions, written materials, sensory accommodations, communication, supports, coordination with caregivers or support staff, AAC-friendly adaptations. Because these adaptations are not reimbursable, clinics often avoid autistic clients. Systemic effect. Clinicians who want to be autism-informed are financially penalized for doing so. 5. Siloed systems. Autism, mental health, and intellectual disability are separate. Autistic adults often fall between systems. Developmental disability services may say, "You're too independent." Mental health services may say, "This is autism, not mental illness." Autism programs may say, "We only serve children." Systemic effect. No single system takes responsibility, so autistic adults get bounced around without support. 6. Bias and misinterpretation, diagnostic overshadowing. Without autism expertise, clinicians misinterpret autistic traits as personality disorders, manipulation, noncompliance, lack of insight, resistance to treatment. Meanwhile, real mental health conditions get ignored. Depression, flat affect, anxiety, rigidity, trauma, behavior problems, suicidality, attention-seeking. Systemic effect. Autistic adults are misdiagnosed, dismissed, or treated with inappropriate modalities. 7. Clinics are designed for neurotypical communication. Most therapy assumes fast verbal processing, ability to identify emotions on demand, comfort with phone calls, ability to tolerate bright lights, noise, and unpredictable environments, ability to answer open-ended questions, ability to track appointments and homework. Autistic adults may need written questions in advance, AC acceptance, slower pacing, sensory-safe environments, concrete examples, predictable structure. Systemic effect. Clinics unintentionally exclude autistic adults because the design assumes neurotypical communication and sensory processing. I am not afraid of this. I am going to get hurt, as I cannot do something myself. I have physical medical records. I am going to do the things I know how to do and capable of doing. I am not going to do things I am not able to do or not understand consequences due to my severe language, reading, and learning disabilities. I ask my viewers to ask me questions and suggest any certain topic on mental health. I may end up making a video on that topic. Please subscribe to be alerted of all the information I have planned for in mental health in February. I cannot wait to hear from you about concerns, personal stories on mental health has failed you or someone you know, and things you have done to be a successful self-advocate to your doctor. If you're interested in disability topics such as treatment, support, accommodations, and rights, like this video and subscribe for more inclusive content. I will talk to you on my next video.